Welcome to today's update on COVID-19 in Alberta. With us today is Dr. Deena Hinshaw, Chief Medical Officer of Health for Alberta. Dr. Hinshaw will provide a brief update and then we'll open the phone line to questions. I'll now turn over to Dr. Hinshaw.
Thanks, Tom, and thank you for coming today. Today, we have identified 49 new cases of COVID-19 in Alberta in the last 24 hours. This brings the total number of cases to 1,500. Of these, 713 people have recovered. This is 121 more than yesterday. We suspect 201 of our total cases may be as a result of community transmission. We have completed 2,123 COVID tests in the last 24 hours. This number does not fully reflect the thousands of Albertans who have had testing scheduled after completing the online assessment tool, as it takes time for this increased volume of requests to make its way through the system. As of last night, I was told that more than 6,000 people had been referred for testing in the previous 24 hours, so I expect the number of tests processed at the lab to rise in the days to come. Sadly, I must report an additional 7 deaths from COVID-19. This is the highest number of deaths we've seen in a single day. This includes 4 new deaths at the Mackenzie Town Continuing Care Facility. There have now been 17 deaths at this facility. To the family and friends of these 7 people, and to all who have recently lost loved ones to any cause, I extend my deep condolences. I know that many people are concerned about the health of residents at continuing care facilities, and I am as well. We are exploring every option to prevent illness and deaths and to keep people in continuing care facilities safe and healthy. This includes examining what other jurisdictions are doing to see where Alberta can do more. Today, in line with this analysis, we are taking new steps to prevent the spread of illness in continuing care facilities. All workers in these sites will be required to wear masks at all times when providing direct patient care or working in patient care areas within 2 meters of others. We are making this change to protect patients from inadvertent exposure from a healthcare worker who could be without symptoms but still be infectious. Continuous masking will also minimize the risk of an asymptomatic or pre-symptomatic healthcare worker exposing other workers to this illness. In addition to new masking requirements, we are requiring all workers in continuing care facilities to work at only one site. This will help prevent the spread of illness between facilities. These requirements are currently in effect at Outbreak locations, but will now be required in all long-term care and supportive living sites across the province. Work is underway with the organizations that provide care in these settings to transition to this requirement, which will be implemented beginning late next week. Lodges with no supportive living designation and group home providers are encouraged to participate in this process of assigning staff to work at only one site, although at this time, for these providers, it is voluntary. We will work closely with providers of care for those living in all settings, from long-term care to group homes, to ensure that residents of these facilities continue to receive the care they need and to mitigate concerns about the supply of staff at each site. While these steps are necessary to prevent the spread of infection to and among elderly people who are at high risk of severe outcomes from this illness, they are not easy. I know many Albertans are finding new ways to connect with their loved ones in continuing care facilities, and I am encouraged to hear your stories. From making signs to hold up outside a family member's window, to virtual visits using a tablet, and especially simply picking up the phone. Thank you for doing your best to make this difficult time a little easier for some of the most vulnerable members of our communities. These efforts will be even more important over the long weekend and in the coming weeks as we work hard to keep long-term care and continuing care facility residents safe and healthy. In addition to these changes, and effective immediately, Alberta Health Services is implementing a policy for all healthcare workers providing direct patient care or working in patient care areas in both AHS contracted provider in community settings to wear a surgical or procedural mask continuously at all times and in all areas of the workplace where social distancing is not possible. This applies if they are either involved in direct patient contact or cannot maintain adequate social distancing from patients or coworkers. AHS is making this change to protect patients from inadvertent exposure from a healthcare worker who could be without symptoms but still infectious. Healthcare workers who do not work in patient care areas or have direct patient contact are only required to mask if social distancing cannot be maintained in the workplace or if entry into patient care areas is required. We continue to remind all healthcare workers that appropriate and judicious use of all personal protective equipment, including surgical or procedural masks, is necessary to conserve supplies and ensure availability through this COVID pandemic. Adherence to the guidelines that have been put out by Alberta Health Services to their staff and the guidance that we will be publishing tomorrow for all continuing care facilities is critical. On a different note, I know Albertans may be fielding questions from the young people in their lives right now. Kids are facing a lot of changes and uncertainty, including doing school online, staying away from playgrounds, and not being able to visit with their friends in person. Today, there is a new fact sheet online at alberta.ca/COVID-19 made specifically for kids and their families. I encourage you to take a look and use the information to have open, honest conversations with kids about coronavirus and the measures we are taking to prevent this spread. I know isolation, physical distancing, and other public health measures may feel particularly difficult over the holiday weekend, and as spring finally makes its way to Alberta. But please continue to take all necessary steps to prevent the spread, follow all public health orders, and reach out to your loved ones struggling with loneliness or isolation. These steps are more important than ever. Thank you for participating in keeping all Albertans safe. Enjoy the rest of your long weekend, and I'll be happy to take any questions.
Operator, could you patch through the first question, please?
Yes, the first question is from Jason Herring. Your line is open. Please go ahead.
Hi there, Dr. Hinshaw. I'm wondering if anything's going to be done to protect workers who are currently at multiple sites, multiple continuing care facilities, who might rely on being at multiple sites for a full paycheck.
So that's one of the reasons that the implementation is scheduled for late next week, is that there are many pieces to put together to implement this large and complex directive. So we will be looking at making sure that workers have, when they're assigned to a facility, that they're, one of the terms that's being used is made whole, so that they're able to work that, full-time FTE. And in certain cases, we are certainly looking at how we can support workers and employers to make sure that people are not significantly disadvantaged by this, because we do know that many workers have multiple part-time jobs. And so that is one of the considerations that will be taken into account as we're implementing this particular direction.
Operator, could you patch through the next question, please?
The next question is from Rob Drinkwater of Canadian Press. Please go ahead.
Yes, I think a lot of Albertans, myself included, a little surprised that masks weren't being required at all continuing care facilities before. Why not, and why now?
So masks were required when caring for patients who had illness for the protection of the workers. That's always been the case. You will recall a little less than a week ago, we talked about the fact that asymptomatic transmission, that the evidence that has been emerging has been deemed to be, at this point, enough evidence that there's a higher risk of asymptomatic transmission or pre-symptomatic transmission than we had previously understood. And so with that emerging evidence, we made sure that we were incorporating that into our policies and guidelines. And part of this recommendation of having workers wear masks at all times is making sure that all of these sites have enough masks, have enough personal protective equipment, so that they can actually put this into place. And so as you can imagine, while there has been work underway for a long time to make sure sites have enough personal protective equipment to protect workers while caring for an ill patient, this will require an increased volume of personal protective equipment for all of those workers to be able to protect the people that they're caring for. And so we wanted to make sure that we had processes in place to enhance supplies and that we were doing all of that legwork so that we weren't implementing this recommendation without the means to actually make it happen.
Operator, could you patch through the next question, please?
Yes, the next question is from Rick Bugowski of Global TV Calgary. Please go ahead.
Dr. Hinshaw, yesterday Dr. Tam said that in terms of long-term care and COVID, we know that there are many more cases that have not been fully reported or detected. I'm wondering if you could elaborate on that as it relates to Alberta, please.
So I'm not sure the context in which Dr. Tam spoke. What we do know is that individuals who are in long-term care facilities can sometimes have very subtle signs of illness at the beginning of an illness with COVID-19. And then sometimes they can progress very quickly to severe symptoms, and in the worst cases, even death within a matter of days. And so I'm not sure if she was referring to the fact that, again, sometimes at the beginning of those illnesses, the symptoms can be quite mild. But what we do know is that we have several outbreaks in long-term care facilities in our province. We know that, unfortunately, many of those have been part of the problem has been workers who are moving from facility to facility and who may not, again, have been aware of, had mild symptoms and have potentially exposed then other facilities. So that's one of the reasons that we're putting this new restriction in place. But again, it's, I wouldn't say that we have a significant amount of illness that we're completely not detecting. One of the other changes that we are making with respect to the new outbreak guidelines are expanding the number of symptoms that their operators will need to be monitoring their residents for. And so again, our previous list of symptoms was about fever, cough, shortness of breath, runny nose, sore throat, diarrhea, or vomiting in those residents. And because we know from colleagues in other provinces and from some of the cases that we've seen here that some of those illnesses can be quite mild, we are expanding that list of symptoms so that we have the best chance of detection of a case as early as possible so that we can further restrict any movement in that facility and limit the spread. So again, without knowing the full context in which she spoke, it would be hard for me to comment, but with respect to Alberta, I would say we know we have a problem with cases in long-term care facilities. We have several outbreaks, and we are doing everything we can to prevent any more outbreaks and to deal with the ones that we currently have.
Excellent. Operator, could you patch through the next question, please?
Certainly. Shannon Johnson, CTV. Please go ahead.
Hi, Dr. Hinshaw. I'm just curious. You say 49 new cases for today. Is that because we've seen an uptake in testing over the past couple of days that we're seeing more than what we have in the past?
So we're seeing a few additional ones. We did have more tests that were run in the last 24 hours. I will flag that the number that I provided just before I came on to this news availability, I was told that we are having some challenges with the syncing of data between our lab and our surveillance team. So we will provide an update if it turns out that the total number of tests is higher than what I reported today. But we know that when we opened up our eligibility for testing to anyone in the Calgary zone, as well as any essential service worker across the province, we did see quite a significant increase in the number of people who were calling to be scheduled for testing. And so our testing numbers, I think, are actually higher than what I reported today. Again, we'll make sure to get that correction as soon as possible. And so our lab positivity rates remain about the same at 2% as they have been across the province. And so again, I think the increase in numbers is based mainly on the increase in eligibility.
Excellent. Operator, could you patch through the next question?
Yes, Julia Wong, Global News.
Hi, Dr. Hinshaw. Thanks for taking my question. You mentioned that the symptoms would be expanded. My understanding today is that Ontario expanded their symptoms to include loss of sense of smell or taste. Or what are the plans to expand the symptoms, and what specifically are those symptoms?
So the symptom expansion that we're including for long-term care residents specifically is broader than the symptom list for the general population because we know, again, that those residents have potentially milder early symptoms, or in some cases, they could be individuals who have cognitive impairment and aren't able to describe, for example, a sore throat. So some of the things that have been added are, for example, a hoarse voice or difficulty swallowing that might be signs of a sore throat, but that person may not be able to actually report the sore throat. So those are some examples of things that we're adding, and we can certainly get that full list to you, but it includes things like new onset of headache, muscle aches, so some of the more general symptoms that can be seen with this illness and with other illnesses. So again, those are just some examples, but we'll get you the full list offline.
Operator, could you patch through the next question?
Yes, Lisa Johnson, Edmonton Journal.
Hi, Dr. Hinshaw. We learned today that there's been a death at a Shepherd's Care facility. I'm wondering if you can update us on numbers of total confirmed cases at that facility in Edmonton. And I'm also wondering if you might be able to clarify those processes you mentioned earlier about acquiring PPE for workers in long-term care facilities, given that we've seen some of them put a call out for donations for these things, so we know that there's a real pinch.
Yeah, for sure. So the first question with respect to the Edmonton long-term care, so Kensington currently has 19 confirmed cases, and as you say, one death, unfortunately. With respect to the process, so we're working with Alberta Health Services as they have the stockpile of personal protective equipment. And so we're providing them with lists of all of the continuing care facilities across the province. And so those shipments will be assembled this weekend and sent out as soon as possible. Over the weekend, we're anticipating that Monday, we'll be assembling over the weekend, and the shipments would be happening on Monday to these sites. So the requirement for masking legally will take effect early next week, as we know that it will take a few days to get the personal protective equipment out to those sites. But we had to set up the process and ensure that the supplies were adequate. That's all in place. And so sites actually will be contacted by Alberta Health Services, and shipments will be arranged for early next week.
All right, we'll take a few more. Operator, could you patch through the next question?
Alex Boyez, Toronto Star.
Hi, Dr. Hinshaw. I'm just wondering that given growing evidence out of the states that certain minority groups are at higher risk for coronavirus, and so some jurisdictions are starting to capture that in their statistics, wondering if Alberta collects any stats, either in terms of who's getting tested or who's getting coronavirus, that are broken down by race or ethnicity, and if not, if you have any thoughts on that.
So it's a really good question, and we know that certain groups of people are systematically disadvantaged based on, again, maybe their appearance or their socioeconomic status. We in Alberta don't currently have statistics by ethnicity with respect to who is being tested. With respect to the report form in terms of our confirmed cases, the information that we collect is really kind of focused more on risk activities and less about ethnicity, but certainly I think it's something we need to look closely at to determine if we need to start collecting that going forward. We do have the ability, working with different First Nations under information agreements and with their requests. So if First Nations request from us data from their particular group, we can work with them to pull that data out of our systems, and we have good relationships with Alberta Health and with different nations in the province, so that is one group that we are able to compare our lists and pull that particular data, but that's not data that we would release publicly unless the nations give us permission to do so, because it is under data sovereignty. It is kind of their call to make that publicly available or not.
We'll take two more, and then we're going to have to wrap up. Operator, could you put through the next question?
Shannon Johnson, CTV.
Hi again, Dr. Hinshaw. We've heard that there could be changes in opinion on whether or not golf courses can open. Is it still the view of Alberta Health Services that because golf courses are non-essential services that they should not be opening?
So it is my view that golf courses are not essential services and as such are not open to the public. They can certainly have workers who can go in and maintain the grounds and prepare. With respect to reopening, just like any other non-essential business, we're watching our data very closely to determine when we reach a point where we can start potentially opening up some of our non-essential businesses, and golf courses would absolutely be included in that, just again like any other non-essential business, and so that would be the context in which that conversation is happening.
And operator, could you put through one final question?
Bill Fortier, CTV.
Hi, Dr. Hinshaw. We've learned that one of the deaths being announced today was a man who worked at a pretty popular local store. And the family's concerned that potentially many customers and many coworkers could have been exposed. I'm wondering, is AHS aware of this? What's being done to potentially track any exposure? And then as a follow-up to that, what are the legal responsibilities, given the public health order that we're under, of a business when they first become aware that a person may have died from COVID? What are their responsibilities? What are they?
So with respect to my role at the Ministry of Health, I have a responsibility for the overall province and the data as it comes in as a collation of data. But my colleagues who work in Alberta Health Services, which is the delivery organization, so the frontline medical officers of health, they're the ones who are responsible for local investigations. And so if they're, as we get new cases reported, what they're doing is they're making sure that with that particular case, they get as much information as possible about when that person develops symptoms, when they would be considered to be infectious, and who would potentially have been exposed with respect to that person. And then they follow up with all of the contacts of those people who are determined to be at risk. And so any details of local investigations are really at that local level. And so the information that I get, if there's something relevant to public risk or something that's unusual that is in the public interest to know, then my colleagues at the local level do inform me of those situations. This particular situation that you're referencing isn't one that I've been informed about. And again, the investigation details are really kept at that local level because that's where the accountability is for those particular pieces of work. With respect to the Public Health Act and the requirements for ensuring that people are kept safe from potential infection, again, that's really where the local public health team comes in, and they are the ones doing that investigation of cases, contact tracing, and making sure that anyone who was potentially at risk is notified and then stays home for 14 days after that last exposure. So the details, again, may be more at that local level.
Thank you all for joining us. There is no media availability scheduled for Saturday or Sunday, though we will update Albertans of any developments through online stats and the situational report. Dr. Hinshaw will provide another in-person update on Monday. Thank you.
Thank you.